CFS-ME versus other fatigue, how to spot the key differences. Imagine feeling exhausted all the time, but not just tired. This fatigue is so severe it stops you from doing everyday things. That's often what sets chronic fatigue syndrome or myalgic encephalomyelitis apart from regular tiredness. Unlike the fatigue from a common cold or busy lifestyle, this kind of fatigue lasts longer than 6 months and doesn't get better with rest. It can be so disabling that even simple tasks like walking or showering become difficult. One of the main signs that points to CFS or ME is post-exertional malaise. That's a fancy way of saying that even minor physical or mental activity can make symptoms worse. Sometimes this worsening can last 4 days or even weeks, which is very different from normal tiredness that usually improves after a good rest. People with regular fatigue from stress or illness typically bounce back quickly, but those with CFS or ME find that their symptoms linger and intensify after activity. Cognitive issues are another key feature. Many people with CFS or ME report what's called brain fog. They might struggle with concentration, forgetfulness, or processing information, and these problems are often more persistent and severe than the tiredness experienced with other conditions. Sleep problems are also common. Instead of waking up refreshed, those with CFS or ME often feel unrefreshed even after a full night's sleep. They might have trouble falling asleep, stay asleep, or wake up feeling just as tired as when they went to bed. CFS and ME are complex illnesses that involve multiple body systems. Symptoms can include muscle pain, headaches, sore throat, swollen lymph nodes, and gastrointestinal issues. These multisystem symptoms are not typical of other causes of fatigue, which tend to be more isolated. For example, fatigue caused by anemia or depression usually doesn't involve such a wide range of symptoms affecting different parts of the body. Diagnosing CFS or ME can be tricky because there's no single test for it. Doctors look at the pattern of symptoms, especially the presence of post-exertional malaise and unrefreshing sleep, and they rule out other conditions like infections, sleep disorders, or thyroid problems. Many other causes of fatigue can be identified through blood tests or imaging, but CFS or ME relies heavily on clinical evaluation and symptom history. Research suggests that CFS or ME might have a different biological basis than simple fatigue. It's believed to involve neuroimmune dysfunction, meaning the nervous and immune systems don't work together properly. This is why symptoms can involve brain fog, pain, and immune-related issues. In contrast, fatigue from lifestyle factors or temporary illnesses usually doesn't involve these complex biological changes. In summary, the main differences between CFS or ME and other types of fatigue are how long symptoms last, how severe they are, and the range of body systems involved. The hallmark features include persistent fatigue that doesn't improve with rest, post-exertional malaise, cognitive difficulties, unrefreshing sleep, and multisystem symptoms. Recognizing these signs is essential for proper diagnosis and management. If you suspect you might have CFS or ME, it's important to consult a healthcare professional who can evaluate your symptoms thoroughly and help determine the best course of action based on your individual health situation.